Hi, my name is Patricia Hernández de Jesús, and this is my video about professional English in use, chapters from 25 to 34. Okay, 25. Okay, this chapter is about mental illness. Yes. Okay, 25.1. Complete the table with words from A, from A, C, D, and E opposites. Noun and adjective. Affect, affective. Anxiety, anxious. Behavior, behavioral. Dementia, demented. Disturbance, disturbed. Disturbed. And suicide, suicidal. Suicidal. Okay, 25.2. Make word combinations using a word from each box. Two words can be used twice. Look at B, C, and E opposites to help you. Okay, behavioral syndrome, eating disorder, major depression, mental retardation, personality disorder, psychomotor retardation, sleep disturbance, substance abuse. Okay, 25.3. Complete the sentences. Look at A, C, D, and E opposite to help you. Number 1, the way a person behaves is his or her behavior. Number 2, a persistent emotional state is a mood. Okay, a sudden attack of anxiety is a panic attack. The form of dementia associated with aging is called senile dementia. Senile dementia. A disorder which is not associated with pathological changes is functional. And an idea which forces a patient to repeat unnecessary actions is a compulsion. Which symptoms of depression was this patient suffering from? Look at C opposite to help you. Okay, case for 1. A 56-year-old woman presented to her GP complaining of increasing tiredness over the past few months. She had lost interest in most things. She was sleeping poorly and tended to wake up early, but denied any suicidal tendencies. She was thirsty and was passing urine more often. She was eating normally and her weight was steady. Okay, her symptoms were tiredness or fatigue, loss of interest, and sleep disturbance. Okay, chapter number 20. Okay, chapter 26 is about the nervous system. Number 1. 26.1. Complete the table with words from A, B, and C opposite. Adjective and noun. Blind, blindness. Conscious, consciousness. Deaf, deafness. Dizzy, dizziness. Numb, numbness. Lightheaded, lightheadedness. And unsteady, unsteadiness. 26.2. Make word combinations using a word from each box. Look at A, B, and C opposite to help you. Okay, double vision, epileptic fit, prodromal symptom, syncopal attack, urinary incontinence, and visual acuity. 26.3. A doctor is trying to determine the cause of loss of consciousness in a 52-year-old man. Complete the doctor's questions, look at C opposite and at the table in 26.1 to help you. Did you lose consciousness suddenly or gradually? Did you get a warning of the attack? What were you doing before you passed out? Were you worried or under any stress at the time? Did you feel dizzy or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any involuntary movement while you were unconscious? Okay, this is over to you. Smells can diagnose Alzheimer's. According to a newspaper's article, research has shown that inability to identify 10 particular smells is an early sign of Alzheimer's disease. What do you think the 10 smells are? Okay, the smells are smoke, natural gas, menthol, leather, pineapple, soap, clove, strawberry, lilac, and lemon. Okay, chapter 27 is about the nervous system. 2. Complete the table with words from A and B opposite. Noun and adjective. Absence, absent. Diminution, diminished. Diminished. Flaccidity, flaccid. Spasticity, spastic. And wasting, wasted. 27.2. A doctor is giving instructions to a patient during examination of the motor system. Identify what the doctor is assessing in each case. Look at A opposite to help you. Number 1, I would like you to relax. I'm just going to move your arm up and down. That's muscle tone. Can I see your hands? That's involuntary movements. Now I'm going to straighten your arm out. Try to stop it. That's power. And number 4, can you touch my finger with yours and then touch your nose? Good. Now do it again with your eyes closed. That's coordination. 27.3. Complete the sentences. Look at A, B, and C opposite. And at the table in 27.1 to above to help you. Number 1, a flaccid hand droops limply to form a right angle with the wrist. Brisk reflexes are reflexes that are stronger than normal. Muscle wasting means the muscle is reduced in bulk. A tic is a form of involuntary movement. Number 5, a key is often used to test the Babinski response. Number 6, his coordination was poor. He could not perform rapid alternating movements. A reflex hammer or a tendon hammer is used to test reflexes. And when something is diminished, it is less than normal. 27.1. A patient is brought to emergency to A&E in coma. When her name is spoken, she opens her eyes, but she doesn't answer questions or obey instructions. What is her Glasgow Coma Scale score? Okay, her GCS score is 5. In eye opening to a speech, that means 3. Verbal response is none, that means 1. And moral response, none, that means 1. Okay, chapter 28 is about oncology. Okay, complete the table with words from A, B, and C opposite. and related forms, verb, noun, and adjective. Cure, 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 and curative. Excite, excision, excite. Grow, growth, and growing. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Palliate, palliation, palliative. Palpate, palpation, palpable. Spread, spread, spreading, spreading. Swell, swelling, swelling, or swollen. Okay, 28.2. The notes below are about the patient described in the opposite. Use them to put the sentences in the correct order to make the next paragraph of the case report. Use appendix 2 on page if you need help with the applications. Okay. Examination of the central nervous system was normal. That's CNS and AD. His mouth and throat were normal. That's oropharynx NAD. There was a smooth fin and 3-4 centimeters mass in the right supraclavicular fossa. That's a smooth, firm, 3 or 4 centimeter mass in supraclavicular fossa. His cardiovascular and respiratory systems were normal. That's CVS, NAD, RS, NAD. Number 5, on abdominal examination, there was a mass palpable 3 centimeters below the left costal margin. That's abdominal mass palpable 3 centimeters below and left costal margin. On examination, his temperature was 37.8 Celsius degrees. That's OE temperature of 37.8 Celsius degrees or degrees Celsius. There were enlarged lymph nodes in both axillary and inguinal areas. That's nodes from 1 to 2 centimeters in diameter, palpable in both axillary and inguinal areas. And his pulse rate was 100 beats per minute, regular, and blood pressure of 112 of 66. That's pulse rate of 100 beats per minute, regular, and blood pressure of 112 and over 66. And 28.3, complete the sentences. Look at A, B, and C opposites to help you. Distant spread of tumor cells is known as metastasis. Many symptoms of cancer, such as difficulty swallowing, are due to obstruction. The opposite of painful is painless. A malignant neoplasm is called a cancer. Tumors which do not invade or metastasize are benign. Secondary tumors are those which result from the spread of a primary. If a cure is not possible, palliative treatment should be given, and a palpable liver suggests metastasis. Okay, chapter 29 is pregnancy and childbirth. 29.1, complete the sentences. Look at A, B, and C opposites to help you. A baby that is born a week before the EDD, that is The expected date of delivery is premature. A termination of pregnancy may be necessary for medical reasons. The first 3 months of pregnancy are known as the first trimester. Fetal distress is the first stage of labor. Is an indication for cesarean section. Number 5, it was a brief presentation and delivery was by forceps. A miscarriage is another term for a spontaneous abortion. And number 7, the umbilical cord was wound tightly around the baby's neck, and it was unfortunately stillborn. 29.2. Complete the table with words from A opposite. Verb and noun. Abort, abortion. Deliver, delivery. Induce, induction. Miscarry, miscarriage. Present, presentation. Terminate, termination. Dr. Bennett, okay, 29.3. Dr. Bennett and senior house officer is presented a patient at a weekly meeting in the obstetric unit of a hospital. Complete the presentation with the correct forms of verbs from 29.2. This is Clara Davis. She came to the antenatal clinic at 9 weeks. In her past obstetric history, she had a pregnancy when she was 18, which was terminated, and another one a year later, which spontaneously aborted or miscarried. Since then, she has had 3 pregnancies. In the first, the baby was delivered normally at 40 weeks. In the second, she had an induction of labor at 39 weeks because of fetal distress. The third baby presented as a breech and was delivered by cesarean section. Okay, chapter 30 is about the respiratory system. Okay, 30.1, make word combinations using a word from each box. Look at A and B opposite to help you. Blood stained, breath sounds, pleural rub, productive cough, and vocal resonance. 30.2, rewrite the questions using words that are better known to patients. Look at A opposite to help you. Is your cough productive? Do you cough up any phlegm? Is it a loose cough? What color is the sputum? What color is the phlegm? Is it ever purulent? Is it ever yellow? Have you ever had hemoptysis? Have you noticed any blood in it? Do you suffer from dyspnea? Any problems with your breathing? 30.3, are the following statements true or false? Give reasons for your answers using your medical knowledge and A and B opposite to help you. A patient who has a loose cough produces phlegm. That's true. A cough may be productive where the patient coughed off phlegm. Number 2, crackles are heard when the airways are narrowed. Okay, that's false because crackles suggest the presence of fluid in the lungs. Number 3, a patient who has a non-productive cough produces sputum. False. There is no sputum in non-productive cough. And wheezes are typical of pleurisy. False. Wheezes indicate narrowing of the airways. And number 5, a pleural rub is a sign of asthma. That's false. A pleural rub is a sound heard when the pleural surfaces are inflamed, as in pleurisy. Okay, chapter 31 is about the skin. First start. 31.1. Complete the description of herpes zoster shingles by replacing the medical words in brackets with ordinary English words. Look at A and B opposite to help you. Number 1, shingles, herpes zoster, usually starts with pain and soreness. Then red spots, macules, appear that develop into groups of small blisters, vesicles, over a particular area on one side of the body. In most patients, new spots, lesions, continue to appear for 3 to 5 days. The small blisters, vesicles, become filled with pus, pustular, and then form scabs, crots. In severe cases, there may be scars, cicatrices afterwards. 31.2. Read the description of the rash of rubella and complete the notes. Look at A and B opposite to help you. The spots are scattered pink macules, which appear first behind the ears and on the forehead. The rash spreads rapidly, first to the trunk and then to the limbs. Okay, location and distribution. First behind the ears and on the forehead, then to the trunk and limbs. And grouping is scattered. Type of lesion is macule and color pink. 31.3. Complete the notes for the rash in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Widespread on the chest and abdomen. Grouping scattered. Type of lesion, small macules with some scales. Color pink, and the possible diagnosis is gorotic psoriasis. 31.4. Complete the notes for the lesion in the photograph and suggest a diagnosis. Look at A and B opposite to help you. Location and distribution. Below lateral angle of the left eye. Grouping, single. Type of lesion, nodule, and color is white and pink. And the possible diagnosis is basal cell carcinoma. Okay, chapter 32 is about the skin, part 2. 32.1. Write the corresponding medical terms for the ordinary English words and say what kind of force is involved. Look at A opposite to help you. Common word, medical term, and type of force. A bruise, contusion, and blunt. Cut, inside wound, and sharp. Grazed, abrasion, and blunt. Scratched, linear abrasion, blunt. Stab wound, penetrating wound, sharp. And tear, laceration, and blunt. 32.2. Choose the correct words to complete the description of the injuries shown in the illustration. Look at A and B opposite to help you. There are grazes above the left eyebrow and on the left side of the neck. A contusion to the left side of the lower lip and tears to the left cheek. 32.2. Write a description of the injuries shown in the illustration. Look at A and B opposite and at 32.2 above to help you. There is a laceration on the left shoulder and an inside wound above the left nipple. And 32.4. Complete the sentences. Look at A, B, and C opposite to help you. Number 1. Frequent changes of position are necessary in the immobile patient to prevent the development of a pressure sore. He had several penetrating wounds in the abdomen from the knife. Number 3, he was shocked unconscious by a heavy blow to the head. And number 4, the wounds were only superficial and required no treatment. Chapter 33 is about the urinary system. 33.1. Look at the conversation in A opposite and complete the notes about Mr. Jones' use medical terms where possible. Okay, complaining of frequency and nocturia for 1 year. No dysuria or hesitancy. Okay, stream flow a little weaker. And no incontinence apart from occasional dribbling. 33.2, match the patient's descriptions of their symptoms with the medical terms. Number 1, I have to pee every half hour or so. That's frequency. I get a scalding pain when I pass water. That's dysuria. I have to get up several times to pass water at night. That's nocturia. I have to rush to go to the toilet. That's urgency. I have trouble getting started. That's hesitance. I can't hold my water. That's incontinence. And I passed some blood in my urine. That's hematuria. Okay, write the doctor's questions for each of the symptoms in 33.2 above. Look at A opposite to help you. You will need to think of your own questions for urgency. Okay, the questions are for dysuria. And do you get any burning or pain when you pass water? Frequency. How often is that? How often do you pass urine? Hematuria. Have you ever passed blood in the urine? Hesitancy. Do you have any trouble getting started? Nocturia. Do you have to get up at night? Urgency. Do you have to rush to go to the toilet in time? And incontinence. Do you ever lose control of your bladder? Describe the findings of the laboratory report in words. Look at the opposite to help you. Blood, protein, and cats. Okay, there was a trace of blood, gross proteinuria, and no casts. And the last one, the 34th, is about basic investigations. 34.1. A doctor is talking to a patient during an ophthalmoscopy. Match the underlying expressions she uses. 2 expressions with similar meanings from A opposite. Right, Mr. Gold, because you have been having these headaches. I'm going to have a look at your eyes, particularly the back of your eye, the retina. I'm going to put a couple of drops in your eye, which will make it easier for me to see the retina. After a few minutes, you may find your vision a bit blurry. This will wear off after about an hour. Okay, number 3. I need to get rid of as much external light as possible. This means closing the blinds. Now I would like you to look straight ahead at that clock. This takes a few minutes and your eyes might feel a bit tired, so you can blink if you need to. I don't want you to look at me. Look at the clock. Okay. Okay, the examination is done with dim lights. That's number 3. I need to get rid of as much external light as possible. This means closing the blinds. The B is a topical mydriatic solution. That's the number 1. A couple of drops in your eyes. In your eye. Okay, number C, to aid dilation. That's number 2, which will make it easier for me to see the retina. And D, fixate on a target. That's 4, look straight ahead at that clock. 34.2, complete the instructions. Look at the opposite to help you. Number 1, wrap the cuff around the patient's upper arm. Place the diaphragm over the area of the brachial artery. Raise the patient's arm so that the brachial artery is at the same height as the heart. Number 3, close the valve on the pump. 4, pump up the pressure to at least 150 millimegahertz. Open the valve a little and slowly deflate the cuff while listening and watching the pressure gauge. The first sound you hear is the flow of blood through the brachial artery. The value of the gauge at that point is a systolic blood pressure. Number 6, continue listening while you slowly deflate the cuff. And number 7, the diastolic blood pressure is measured when the sound completely disappears. 34.3, complete the test. Look at C opposite to help you. Phlebotomists are especially trained in taking blood. They are skilled at puncturing the vein to take a blood sample. The wrist, hand, and foot can be used, but more often a vein in the inner part of the elbow is used. If it is difficult to locate a suitable vein, the patient may be asked to make a fist, or a tourniquet may be applied on the upper arm to make the vein more apparent. Afterwards, a dressing is applied and the patient is asked to breathe gently. This helps to stop the bleeding and prevent bruising at the site. It is important that specimen tubes are labeled correctly before they are sent to the hematology laboratory, where a full blood count or other investigations will be carried out. That was everything. Thank you so much.